Welcome students to MBBS online lecture. The topic for today's lecture is about we are going to solve blood module test. There are a total of 50 questions in a file. So let's get started. Now this is a official past paper of LUMS that was taken on 15/7/2021. This is a paper of blood module hematology module test, as you can see. The picture is not clear, but we still can see and read the questions and its options. So the question number 1 is about the transfer of immunity from mother to baby is an example of is a type of which type of immunity. So number A is a acquired immunity, number B is inactive immunity, C is passive immunity, D is innate immunity, and E is artificially acquired immunity. So transfer of antibodies from mother to baby through placenta, or we can see through mother milk, is a type of passive immunity, or still we can specify it as the type of passive natural immunity. So the option is going to be the C. Now let's move toward number 2. The spread of blood-borne infection from unsafe injection practices is an example of direct contact transmission, vertical transmission, indirect contact transmission, or contact with soil, or incubation into skin or mucosa. So since these are from the unsafe injection practices, this is going to be the indirect contact transmission. So C is going to be the correct answer. Now number 3 is about the body's last line of defense. Third line of defense against pathogens in immune system are number A skin, WBC or phagocytes, C antibodies, D saliva, or E tears. According to these options, the antibody is going to be the last line of defense because skin provides first line of defense, while the saliva and tears provide second line of defense, and WBCs are basically tissue macrophages provide also second line of defense. But the antibodies that are produced in response to any antigen is the last line of defense. Moving toward number 4, a 65-year-old woman present with the pain and swelling in the right leg. On examination, area where the calf muscle is warm and tender. Doppler ultrasound of a leg suggests deep vein thrombosis. Patient is admitted to the hospital and is given enoxaparin. The mentioned drug is different from the unfractioned heparin due to the following property. It is given by intravenous infusion. It has shorter duration of action. It can be used without monitoring of activated APTT. It is more likely to cause heparin-induced thrombocytopenia. It is given 3 times a day. So when looking at the options of the number 4, option C is going to be the right answer because all the anticoagulants are given by intravenous infusion, while the D answer says it is more likely to cause heparin-induced thrombocytopenia. It is the property of heparin and cannot be caused by these drugs. So it has shorter duration of action, and that is given 3 times a day, are basically same answer, that it has shorter duration of action, that's why it is given 3 times a day, while it can be used without monitoring APTT is basically the specific property of this drug. Now moving towards number 5, 50-year-old woman is being treated with a LT-PAS plus for the treatment of acute ischemic stroke. 5 minutes after starting infusion, patient develops swelling of the face, lips, and tongue. Drug from which of the following groups increase the chances of angioedema, which administered with LT-PAS? Number 8, thiazide diuretics, loop diuretics, angiotensin converting enzyme inhibitors, beta blockers, calcium channel blockers. Angioedema is basically is a specific side effect of angiotensin converting enzyme inhibitors. These drugs include captopril, enalapril, and lisinopril. Moving to our question number 6, 35-year-old vegetarian woman went to the physician with a complaint of fatigue, shortness of breath on exertion. She looks pale and also complains of burning sensation in hands, feet. Which of the following drug will be given to the patient to improve her symptoms? Number A, cobalamin, number B, serum B6, C, folic acid, or homocysteine, E, high fiber diet. It's going to be the number A answer, which is a cobalamin or vitamin B12. Vitamin B12 basically is given to prevent the megaloblastic anemia, as well as these are given in the to prevent the peripheral neuropathy. Moving toward question number 7, an 18-year-old girl comes at OPD with a complaint of unexplained fatigue and fast heartbeat. She has given also history of heavy menstrual flows during last year. On examination, her conjunctiva are pale and her hemoglobin percentage is 8 gram. What is the preferred route of iron supplementation in this patient? Number A, intravenous, B, intramuscular, C, subcutaneous, D, oral, or C, E, sublingual. So intravenous route is well preferred for the iron supplementation, since the woman is severely deficient in iron or hemoglobin percentage. So iron supplementation are needed to prevent the iron deficiency anemia. Intravenous basically provides it is the fastest route, and drug is directly injected into a systemic circulation, so has fast onset of actions. Moving toward question number 8, a patient develops heparin-induced thrombocytopenia in response to unfractioned heparin, but still requires anticoagulant for treatment of this medical condition. Which of the following drug will be used as an alternative to UFH in this patient? Abciximab, argatroban, tirofiban, etiflubatide, aspirin. It's going to be then option E, because aspirin is given or indicated in the patient with the inflammation, as well as for treating, or we can say it can be used as anticoagulant. A young boy age 5 was found to be severe anemic. His hemoglobin was 4 mg per deciliter. Erythropoietin was prescribed by the pediatrician as treatment. To check the response of the given treatment, which cell count in the peripheral blood indicates the active functioning of the bone marrow? Erythroblast, reticulocytes, erythrocytes, neutrophils, and lymphocytes. Bone marrow, basically functioning of the bone marrow is checked by the presence of reticulocytes. A 16-year-old boy was brought to the operation theater for appendicectomy. Which of the following cells would be raised? Neutrophils, lymphocytes, eosinophils, basophils, or macrophages? So it's going to be number A, which are neutrophils. Neutrophils are basically increased when there is any short surgical procedure. Now, coming towards question number 11, most harmful effect of polycythemia on circulatory system can cause thromboembolic phenomena. This is due to increased viscosity of blood, increased hematocrit, increased cardiac output, increased blood volume, or increased arterial blood pressure. So it's going to be option A, which is increased viscosity of blood, because increase in the viscosity of blood can lead to the risk of thrombosis or embolism due to hypercoagulability of blood. Now question number 12, the child is suffering from severe bleeding after undergoing circumcision. Parents of the child revealed that all their son had this problem after circumcision. The child is diagnosed with a case of hemophilia, absence of which of the following clotting factor is commonly cause of this disease? Number A, calcium ions, factor 13, von Willebrand factor, factor 13, or factor 3. These options have some mistakes because the factors 13 are written 2 times, while there is no factor 8, which is deficient in hemophilia. So it's going to be factor 8. Now moving toward question number 13. After an acute attack of myocardial infarction, usually doctors get the injection of streptokinase to dissolve the clot. How is streptokinase dissolve the clot? Removal of prothrombin from blood, activation of activated factor 5, inactivation of activated factor 7, stimulation of tissue plasminogen activator inhibitor, activation of plasminogen to plasmin. Streptokinase basically works by stimulating tissue plasminogen activator. Sorry, it is caused by it. Basically, it affects the dissolution of the clot by activation of plasminogen to plasmin by tissue plasminogen activator. So it's going to be the option E. Question number 14 is about a patient who was operated for intestinal perforations. Post-operatively, he developed megaloblastic anemia. Which part of the intestine might be removed in this patient? Ileum, duodenum, stomach, esophagus, or jejunum? It's going to be option A, because the vitamin B, due to deficiency of vitamin B12, the patient develops megaloblastic anemia, and the vitamin B12 basically absorbed in the ileum part of the small intestine. Now coming toward the question number 15, a 6-year-old boy bruises easily and has a previously bleeding gums. The maternal grandfather also has a bleeding disorder. You suspect a deficiency of prothrombin activator, factor 2, factor 8, factor 10, or factor 13. It's going to be factor 8, which is a case of hemophilia, because the boy also had family history of these bruises, easily bruising and bleeding gums. Now question number 16, features of mature RBC include: they have no cytoplasmic organelles, able to synthesize new proteins, able to carry oxidative reactions, can synthesize hemoglobin normally, able to undergo mitosis. So as we all know, the RBCs don't have any organelle in their cytoplasm. So it's going to be A answer. Now question number 17, in fetal hemoglobin, the arrangement of the polypeptide chain is 2 alpha 2 beta, 2 alpha 2 delta, 2 alpha 2 gamma, 2 alpha no beta, 2 alpha 2 zeta. It's going to be option number C, because the fetal hemoglobin or HbF contains 2 chains of 2 alpha chains and 2 gamma chains. Question number 18, features of polycythemia vera include: is a physiological condition, occurs at high altitude, spleen and liver are enlarged, person become anemic, blood volume is decreased. So it's going to be option number C, because the polycythemia vera or primary polycythemia is not a physiological condition and not caused by the high altitude. This is the case in secondary polycythemia, while the increased level or increase in number of RBC can cause the spleen and liver to be enlarged, causing hepatosplenomegaly. Since the volume is not decreased due to its polycythemia, blood volume is increased and the person does not become anemic, because there are more RBCs in the blood to carry hemoglobin. Now question number 19, eosinophils are attracted to the site of allergic reaction by eosinophil chemotactic factor released from neutrophils, basophils, monocytes, lymphocytes, or plasma cells. So eosinophils chemotactic factor is released by basophil cells. Moving toward question number 20, red blood cells depend mostly on aerobic glycolysis for the generation of energy because of the lack of following organelles of cell: nucleus, ribosome, lysosome, endoplasmic reticulum, or mitochondria. It's going to be mitochondria, because mitochondria is the powerhouse of the cell where the ATP are produced by the aerobic glycolysis and oxidative phosphorylation of the glucose. So most serious hazard of mismatched blood transfusion is jaundice, renal failure, anemic, cardiac failure, acidosis. So most hazardous mismatch or most complication of blood transfusion reactions are going to be the renal failure. Release of chemicals from basophils and mast cells are responsible for which type of reaction in the body? Anti-allergic reaction, acute inflammatory reaction, anaphylactic reaction, chronic inflammation, or autoimmune reaction. It's going to be option number B, because the basophils and mast cells are involved in acute inflammation, not in chronic inflammation, and also not in autoimmunity. Functions of interferon include decreased macrophage activity, decreased production of antibodies, enhances actions of natural killer cells, destroy foreign cells, or destroy transplanted cells. For question number 23, the answer is going to be the option D, because the gamma interferon is involved in increasing the macrophage activity and also increasing the antibodies, while the natural killer cells are not induced by the gamma interferon. And the transplanted cells are basically attacked by cytotoxic T cells, while to destroy the foreign cells, the macrophages are activated. Question number 24, A 24-year-old woman who had previously uneventually transfused received a blood transfusion reaction during surgery and shortly thereafter develops itching, generalized urticaria, laryngeal edema, and dyspnea with wheezing respiration. She has a past history of recurrent respiratory tract infection and a frequent episodes of diarrhea. Laboratory studies are most likely to reveal decreased concentration of which of the following immunoglobulins: IgA, IgD, IgE, IgG, or IgM. For question number 24, the option is going to be IgA because the patient is also has a history of recurrent respiratory tract infection, while the IgA basically release in the secretions, which include secretions in the mouth, or we say trachea or bronchi, or we can say in the esophagus or whole GID. So IgA is responsible. Deficiency of IgA can cause these symptoms. Question number 25. 2 days after receiving an anti-malaria drug, primaquine, a 27-year-old African American man develops sudden intravascular hemolysis resulting in a decreased hematocrit. Hemoglobinemia and hemoglobinuria examination of the peripheral blood vessel reveals erythrocyte with a membrane defect forming bite cells. When a crystal violet stain is applied, many Heinz bodies are seen. Which of the following are the most likely diagnosis? Hereditary spherocytosis, G6PD deficiency, paroxysmal nocturnal hemoglobinemia, microangiopathic hemolytic anemia, autoimmune hemolytic anemia. So based on the presence of a bite cells in the peripheral blood vessel and also Heinz bodies, the G6P deficiency of G6P glucose 6 phosphate enzyme is basically made. So the option is going to be option B. Moving to our question number 26, a 19-year-old offensive tackle for a major junior football team fractures his right femur during the first game of the season. He is admitted to the hospital and over the next several days develops progressive respiratory problems. Despite extensive medical intervention, he dies 3 days later. At the time of autopsy, oil red O positive material is seen in the small blood vessels of the lungs and the brain. Which of the following is the most likely diagnosis? Air emboli, paradoxical emboli, amniotic fluid emboli, fat emboli, or saddle emboli. So diagnosis of fat embolism is made because the person is having also fracture of the right femur that is a major risk factor for the fat embolism. Question number 27. A 65-year-old woman present with an increased fatigue and breath physical examination found decreased vibratory sensation in her lower extremity. Laboratory examination found pancytopenia, while hypersegmented neutrophil and oval macrophocytes are seen in her peripheral smear. Which of one of the listed laboratory tests would best help to identify the etiology of her peripheral blood abnormalities? A. Coombs test, B. Meta-bisulfite test, C. Osmotic fragility test, D. Schilling test, or E. Sucrose hemolysis test. So in question number 27, the person is already having the decreased vibratory sensation due to the peripheral neuropathy. So this can be the diagnosis of megaloblastic anemia, or we can say deficiency of vitamin B12 that causes these types of symptoms. So to identify the etiology of this peripheral blood smear, we can use chilling test for the deficiency of vitamin B12. Question number 28. A 3-year-old boy with microcytic hyperchromic anemia with the presence of target cells on the peripheral smear hemoglobin electrophoresis demonstrate a HbA to 5.4%, HbF 1.6%, and HbA 93%. Iron studies on normal patient has never received any blood transfusion. The most likely diagnosis is number A, alpha thalassemia trait, beta thalassemia trait, beta thalassemia intermedia, or beta thalassemia major, E, hemoglobin H disease. The diagnosis of beta thalassemia intermedia is made because the HbA2 is slightly increased while the HbF is also increased, and also there are target cells on the peripheral blood smears. Since the person does not, the iron studies are normal and the iron serum ferritin is normal, the diagnosis of beta thalassemia major is ruled out. That's why the diagnosis of beta thalassemia intermedia is made. Now, question number 29. Leukocytes immigrate in tissues toward site of injury by process of opsonization, exocytosis, chemotaxis, phagocytosis, transcytosis. So chemotaxis is basically the process of migration of leukocyte towards the site of injury. 30. Which of the following clinical manifestations seen in the thrombocytopenia and qualitative platelet disorder? Petechiae, hemarthrosis, hematomas, delayed bleeding, or hemothorax? The diagnosis of petechiae, or we can see the presence of petechiae, is a well sign and a very specific sign for the thrombocytopenia as well as qualitative platelet disorder. Petechiae are basically minute hemorrhages under the skin that can be seen with the naked eye. 31 says which one of the following thrombotic disorders is the most common inherited cause of venous thromboembolism? Protein S deficiency, protein C deficiency, prothrombin A mutation, or we can say factor V Leiden antithrombin deficiency. Deficiency of factor V basically is the most important cause of the thromboembolism disorders. So factor V Leiden is the most common genetic deficiency of antithrombin, or we can say that can cause the venous thromboembolism. Question number 32. Which one of the following situation will lead to intravascular hemolysis? Group A RBCs to Group A recipient, Group O RBC to Group AB recipient, Rh positive RBC on Rh negative recipient, Group A RBC to Group O recipient, Group A RBC to Group AB recipient. It's going to be option D, because in number option A, Group A which has no antigen can be given to recipient Group A, while Group A also can be given to the recipient with the blood group of AB. Rh positive can be given to Rh negative if the person is not previously sensitized, and the hemolysis due to the or the transfusion reaction due to Rh factor is very delayed and cannot occur immediately. That's why the group A, if the group A RBCs are given to group O recipient, this can lead to the fast hemolysis of the RBCs. That's why the intravascular hemolysis will be caused in this transfusion. Now question number 33 says familial predisposition into develop localized hypersensitivity reaction to a variety of inhaled antigen refers to allergy, tolerance, anaphylaxis, atopy, autoimmunity. So for question number 33, the option D is correct, which is atopy. Question number 34 says the growth rate of bacteria during the maximum stationary phase of a growth is 0, increasing, constant, decreasing, or negative. So the growth rate during the stationary phase is basically constant. Question number 35 says which one of the following is a predominant normal flora of the skin? Staphylococcus epidermidis, Corynebacterium, or Parvitella intermedia, bacteriocytes, or which is Pseudomonas aeruginosa. Option A is correct because this bacteria is also the name of the skin, first layer of skin in its name, such as epidermidis. Question number 36. Firm adhesion of a glycoside to endothelial cells is mediated by selectin, integrins, defensin, anthilins, or glycoproteins. Firm adhesion of glucoside is basically mediated by integrins, while the loose adhesion is caused by selectin. Which one of the following features is characteristic of platelet disorders? Rare mucosal bleeding, common deep hematomas, persistent bleeding from the skin cuts, most occur in females, rare petechiae. So most common feature or the characteristic of platelet disorder, whether it is qualitative or quantitative, the persistent bleeding from the skin cuts is the most common. So option C is correct. Question number 38. C-reactive protein, a plasma protein that is elevated during inflammatory and infectious C-reactive protein, inflammation and infections. So C-reactive protein falls into the category transport proteins, clotting proteins, plasma proteins, acute phase proteins, or receptor proteins. So C-reactive proteins are from the category of acute phase proteins. Question number 39 says, which of the following plasma protein is not involved in iron hemostasis? Haptoglobin, transferrin, ferritin, ceruloplasmin, or albumin? The ceruloplasmin is not involved in the iron hemostasis. Question number 40, the following condition is altered: A to G albumin to globulin ratio less than 2 with decreased plasma albumin concentration. Chronic hepatic cirrhosis, acute hepatitis, obstructive jaundice, increased alcohol consumption, UTI, urinary tract infection. So the ratio of albumin to globulin can be decreased in the chronic hepatic cirrhosis. During the biosynthesis of porphyrin, there is enzyme which is rate limiting. Which one of the following enzyme lies in the rate limiting category? Delta amino levulinate synthase, or porphobilinogen dehydratase, porphyrinogen carboxylase, uroporphyrinogen decarboxylase, uroporphyrinogen 1 synthase. The rate limiting enzyme for the biosynthesis of porphyrin, or we can say the hemoglobin, is the ALA synthase, which is amino levulinic acid, or we say levulinic synthase. So A option is correct, which is a rate limiting enzyme for the synthesis of porphyrin. Question number 42 says, uroporphyrin and coporphyrin of which series are excreted in urine in congenital erythropoietic porphyria? Type 1, type 2, type 3, type 4, type 5. So these are of type 3 that are released in the urine. Question number 42, which vitamin is synthesized by intestinal bacteria? Vitamin B, vitamin D, vitamin K, or vitamin E, or vitamin C? So we all know that vitamin K is synthesized by intestinal normal flora. A 60-year-old man present with a lymphadenopathy, fevers, dyspnea, weight loss with a recurrent infection. He is diagnosed with a case of lymphoma, tumor, lymphatic system. All lymphoid organs perform which of the following function? Production of lymph, filtration of blood, extramedullary hematopoiesis, production of lymphocytes, or destruction of old RBCs. So all the lymphatic system, or all the lymphatic organs that are present in the body have a common function, that is the destruction of old RBC or senile RBCs. A 48-year-old man presents to the emergency department with 6-week history of progressively worsening abdominal pain and night sweats. Physical examination findings were significant for palpable bilateral 2 cm axillary lymph nodes. On microscopy, endothelial venules in the lymph node are lined by which epithelium? Simple squamous, pseudostratified ciliated columnar, stratified squamous, simple cuboidal, stratified columnar. So as we all know that the endothelial venules, or whether it is veins or it is arteries, the endothelium is lined by simple squamous. Question number 46, in a patient with a bone marrow disease, which one of the following cell may develop from site? Monocytes, lymphocyte, megakaryocyte, neutrophil, or red blood cell? This is going to be the lymphocyte, because lymphocyte can be produced in the thymus other than bone marrow. A histologist on a microscopy found a tissue partially covered by stratified squamous non-keratinized epithelium, shows crypts and hemicapsulated. These histological features are suggestive of which of the following? Peritoneum cell, spleen, thymus, lymph node, or bone marrow? Since the organ or the tissue that is being examined by the histologist has a stratified squamous non-keratinized epithelium which shows crypts and it is hemicapsulated, the diagnosis, or we can say the option A, which is a palatine tonsil, can be correct. During embryogenesis, which of the following is the earliest site of hematopoiesis? Bone marrow, liver, spleen, yolk sac, thymus. Earliest site for the hematopoiesis during embryogenesis is from the yolk sac. 49, severity of a disease, mild, moderate, severe, or level of knowledge is an example of ordered, ordinal variable, unordered variable, continuous variable, discrete variable, or categorical variable. It's going to be option D, discrete variable. What will be the mean of 25, 26, 27, 28, 29, and 30? There's a simple answer, which is 27.5. Now that was the last question of this file, and we have completed blood module test as well. Since we have also uploaded the short test of the foundation module, which have around 90 to 95 questions in it. Hope you like this video. If you like, share it with your friends and also subscribe the channel. We have also been working on our website, which is www.mbbsonlinelecture.weebly.com. You can visit there and get ton of the lectures from the LECTURIO Osmosis, as well as you can get benefit from their high yield PDF of Osmosis. If you have any query, you can contact us on our email address, which is lumpsonline2021@gmail.com. I will leave these details in the description below. You can contact us. Thank you for watching. We'll see you in next video.